not disclosure. So if you're a broker listening to this call, this really part of it is for you, but it's not. I'm really targeting employers here. So basically, moving on after December 27th, any new contract that you enter into with most health plan service providers, there's going to be probably rules on this, but it's pretty well defined. So it's not just your broker, your TPA will probably have to will do it. They should. Care managers, like other people that you work with in administering your health plan, they're going to have to disclose to you with all your new contracts any compensation they get from your plan, specific to you, not all the money that they're ever paid, but the money that they get paid off of your plan that's more than $1,000, that's either direct or indirect. And they have to then and they have to give you a description of that services, and like this very specific description what they do for their money, and very descriptive. It's very prescribed for them how they come out. It doesn't have to be on a set form, so you're not going to get like we talk about employer reporting. It's not going to be a statement like a 1095C. So far that we know, they're going to be able to put it out there in their own paper or give it to you part of their contract perhaps, but it's going to have to be in there. And they have to do it in advance of, like, if they make a change to your contract, then you're going to have to get a new one that affects the compensation. You're going to have to get a new one. Now, you guys should be prepared to get these next year. And here's why. It's not something that you could just throw out into the circular file. If they don't give it to you, guess who gets in trouble? The employer. The employer plan sponsor. They have to give it to the employer plan sponsor, and you're the one that doesn't gets in trouble if they don't give it to you. So you have to be looking at your providers and saying, where is it? And then if you don't report it, then if they don't get it, you don't get it, you have to contact the Department of Labor, and the Department of Labor is going to be putting out information for you because it's not due yet. But sometime over the summer, you're going to get information about like where do you put it in and like how do you tell on them. And you're going to want to do that, even though you might feel bad about it, because guess what? Remember how we talked about those ERISA penalties? You're going to get penalized if you don't do it. It's actually going to be a prohibited transaction to your plan, which has even more expensive penalties, like in the thousands of dollars. And it can really affect the ability for you to administer plan going forward. So that's all in there. And the reason why they put all this in, you're like, why? Why are they doing this? Two reasons. One, they wanted to do the surprise billing stuff. This is the inside baseball. So they wanted to do the surprise billing stuff, and they had an old bill that had it in it, and they had a couple of different drafts. And the very first draft had this in it too. Then they decided to ditch it because they were like, this is too complicated. The brokers are upset, the providers are upset, and the employers are kind of like, it's a little icky for us. So they ditched it. But then they passed this Consolidation Appropriations Act. It's 5,000 something pages because Congress doesn't really pass a lot of laws anymore. So they put like everything but the kitchen sink in. I mean, this is hundreds of pages, but this bill was the longest bill that Congress has ever passed. So it had like foreign policy, education funding, COVID stuff, like all kinds of stuff in there. So literally they're pulling it all together at the last minute. And I don't know who, but somebody pulled up the old draft and they dropped all the old provisions into this law. So a lot of people woke up once it was like out there and they had signed it and they were like, what? We put what in? So if you've ever just sent somebody the wrong version of a file, this is kind of the equivalent. Now, the reason why they came up with that file to begin with was they wanted to lift up the level and make employer and plan sponsors take their health plan administration a little bit more seriously. They feel like, and the Department of Labor has had a long-standing position on this, that everybody's really, really serious about their retirement and pension plans, and the health plans are kind of like, it's fine. And they kind of ignore requirements. So they wanted to like lift the status of the plan or fiduciary and make you feel like you really have to do your work and get nervous. So that's why you have to do it. But anyway, from your end, be prepared to get these. Be on the lookout. I am absolutely certain that Connor Insurance and Total Control are going to send you their statements in this winter, and they're going to tell you, look out for these, and here's where you call if you don't get them. And the service providers that they work with, they're going to be saying, look, you got to give our employers their stuff, and asking, how are you going to get it? So you can know that. But if anybody else approaches you to work with them, or you're thinking about working with another service provider, like a different Cobra administrator or something like that, one of the things you're going to ask is, where is my stuff? And if they don't give it to you, be prepared to tattle on them, and don't feel bad about it, because you don't want to get punished. So that's the comp disclosures. Oops.
So Jessica, that just reminds me of proactively narking on my brother as a kid so that I wouldn't get busted. You know, like I may have done something, but what he did was worse. And so, yeah, that's why we got to make sure that employers are proactively narking on their service providers, right?
Yeah, yeah, and it's kind of brilliant, right? Because, like, all the providers are actually gonna do it, because if they don't, how are they gonna keep their clients? I mean, it puts employers in a really bad position, don't get me wrong. But and here's the thing, if you're a service provider, you're gonna know, like, there's a good competitive advantage. Did you do it? Tell the employer that they didn't get it from the other people, and they could get in trouble. So, I mean, there is some crazy brilliance in this strategy. I feel like, yeah, it is kind of like the narking parenting. I feel like whoever came up with this originally is one of those really good parents that can come up with those, like, really good related consequence punishments, things like that, that I'm not always good at coming up with on the spot. Whoever did this read their, probably has some PhD in psychology too.
Right. This is not the equivalent of no tech for a week, right? This is what really
Yes, yes, yes. This is like, this really gets you to act. So
okay.
I don't know, maybe that's also something we can all take away from this. Some plus, if we can all translate this into our real lives, and maybe be able to motivate people's behavior, that we need to change their, maybe there's something to be learned here from that. I don't know.
Okay, so real quick, a couple questions on this. So this references the plan. So let's say you're an employer that has a wrap document, and all of your health plan and everything else is underneath this wrap document. So do I need to then lump in the service providers for my self-funded short-term disability plan and my dental provider plan and all that stuff too, or is it just related to the health plan itself?
This relates to the medical benefits.
Got it.
So, yeah.
Got it.
But
Uh,
you may get comp disclosures from other people just because 'cause they're nervous. And hey, if you're a vendor that does different things, you may just make it part of your policy. So you may start getting more stuff than you ever thought you wanted. And, I think from the employer's end, it doesn't really matter if they report in that somebody didn't do it wrong. That's the Department of Labor's problem to suss out. If I were the employer, I would just be more into over-reporting and being like, "Where's my stuff?" And if someone says, "I don't have to give it to you," I would be like, "Show me. Why don't you have to give it to me? Because you don't wanna get in trouble."
Perfect. Perfect. So just two other questions for you then. So if we have an unbundled self-funded plan, for example, and we hire a virtual mental health providing firm to help us with that, and we've got a PBM, and we've got somebody that we're using for durable medical equipment over here, and I've got 7 different kind of unique niche providers. I need to get those from all of those, assuming they're I'm paying them $1,000 more, correct?
Yeah, yeah. Now you may have, for example, again, in, like, the TPA agreement, you might have something like, who's responsible for paying what. So the TPA may be paying them, and they may be giving, like, that information from them, but they may say, like, the TPA agreements, it might, like, outline who can you expect to get from what, right? Because they're, so that's something that you might want to look at and see who's responsible for giving it to you. So you may have some service providers agreeing. So, like, if if the TPA has hired out somebody else to do their utilization management, like, depending on how those fees are paid, it may be, one bigger service provider providing you for all of it. It just, I think it depends on the contracts. And so that's, again, another, like, a big takeaway here is, hey guys, those contracts are always important, but they're really important now. So you're going to want to be reading them and saying, what am I agreeing to here? And what should I be expecting from who and what? That they'll be very evocative, when you do your renewals, and being proactive about that, I think, is very important.
Perfect. Two final things. One, Ben and I were just discussing this yesterday, and we think this is an incredible side effect of this particular piece. So it may feel very burdensome to employers, and we understand that. But think about this. If you just think about pharmacy benefit managers, your PBMs, and for a long time, for 10 years plus, we've been beating employers over the head. Think about rebates. Where are your rebates going? Well, PBMs figured that out too, and they stopped calling the majority of the fees they get rebates because employers were so focused on, giving my rebates back. But there's 25 plus different ways that PBMs make money. They sell your data, they, on and on and on and on and on. So theoretically, if there's, the rule is direct and indirect compensation. So theoretically, the PBM should now have to disclose all of the money they're making off of a plan, which will shed a lot of light on a very, very dark corner of health plans. Would you agree with that?
Yeah, I mean, like, this is all so while, like, this is different requirement, it's all to get the costs out there. Like, it is all to shine a direct spotlight on it. And the next requirement that we're gonna talk about also is that you mentioned PBMs. This is all aimed at RX disclosures, but again, unfortunately, the employer has a role in it, so.
Perfect. And then the last final thing is counter insurance does a great job. We at the Total Control Health Plans are all about transparency and disclosing how much we make. And we're all about it. We'll certainly meet that requirement and we'll make sure that the folks that are plugged in with your plans do the same. But this is a good thing and it will become standard operating procedure in the not too distant future. So we're excited about it. And Jessica, I'll turn it back to you to hit RX data reporting.